Hi, everyone. Welcome to Black in Focus. I'm Karen Toulon here in New York, and I am really excited today. Today, we're going to be talking about COVID-19, kind of the facts and a little bit of the fiction. We're here with Dr. Italo Brown. He is the Assistant Professor of Emergency Medicine and the Health Equity and Social Justice Curriculum Lead. That's a lot at the Stanford University School of Medicine. Dr. Italo Brown, welcome. Thanks for joining us today.
It's a pleasure to be here, Karen.
And so you're also the Chief Impact Officer with something called TrapMedicine. It's a barbershop-based wellness initiative that works with barbershops and Black men and boys around wellness. And that'll be important when we talk about COVID-19 and communities of color a little bit later. But I really wanted to start off with the basics, just trying to get to the facts of where we are right now with the pandemic, which seems to be kind of really fast moving in the last week. There've been a lot of developments. Kind of at the same time, we're kind of getting ready for back to school in some parts of the country. We're hearing more about masks indoors for people who've been vaccinated. So can you tell us, where do we stand right now? What do you understand the CDC guidelines to be?
Certainly. So the biggest concern at the moment is the emergence of the Delta variant as a predominant variant in terms of disease illness, or rather the severe illness. And we've done a reasonable job of trying to get vaccination canvassed across the U.S. However, we're not where we need to be. And what we're seeing now is that this Delta variant is a little bit more, causes severe illness. It happens a little bit more rapidly. And we see that the similar trends in terms of racial ethnic backgrounds, like those communities and populations are still being affected at a greater proportion than the dominant culture. So there's a greater concern among, I would say, most of healthcare professionals that we are not as good in the fight as we thought we once were.
And so that's why we're hearing about the return of masks indoors. How does that help? Just some people may be wondering, if we took masks away and now they're coming back again, how does that actually help?
So the same concept from the very first time where we, kind of really emphasize mask wearing, where you reduce the risk of transmission because we know how it's transmitted by wearing masks. And with the kind of lax stance on masks that have kind of been demonstrated over the last several months, we know that the vector, the way that it is passed, has also not changed. So using that particular prevention, it's so simple, so easy, and everybody can do it. We aggregately reduce the risk of transmission. So I think that the reason why we're moving back towards mask wearing, even though for some people it represents kind of a step backwards, it's also a safer step.
Okay, now, as far as the vaccine goes, we have a Bloomberg vaccine tracker. Here in the U.S., we've had around 343 million doses administered. That's covering around 53% of the population. Globally, almost 4 billion doses, around 25% of the global population. Can we vaccinate our way out of this? Is that gonna work?
That was pretty clever. I do think that we can get closer to what's called herd immunity through vaccination, right? So it's the concept that a significant or a minimum threshold of people have antibodies against coronavirus, specifically SARS-CoV-2, to where the potential likelihood of negative outcomes is reduced significantly. So vaccination, what it does is it allows us to it's a cheat code. It allows our bodies to develop those antibodies faster. And then we get to that minimum threshold at a more rapid rate. We can't vaccinate ourselves out of behavioral issues, though, meaning like we can't vaccinate ourselves out of doing things that do not seem safe, like having no mask on indoors with people who we have no clear understanding of vaccination status. We can't vaccinate our way out of washing hands and doing the practical things that each of us has been taught ever since we were children to try to reduce disease transmission.
You spoke with Dr. Fauci. I think it was last week. Is that right?
It was in the beginning of this month, but yes.
Yeah. Did he say anything to you that particularly resonated with you or surprised you, or is he consistent on message?
So I think he's consistent with his message. The most surprising thing to me is, one, he doesn't mince words when it comes to the steps that we can take to reduce overall risk of severe illness. Vaccination is something that has been demonstrated to essentially improve our chances of getting back to normal, as close to normal as possible. The other thing that I found really interesting is he leans into the understanding that communities of color have significant mistrust of the healthcare system. He acknowledged outright that, this is not gaslighting. This is an actual thing that exists based upon historical events and context. So I really appreciate hearing a leading expert and a leading official globally really acknowledge the trauma that people of color have endured with healthcare systems, and that we are right in questioning whether or not vaccination is for us. But on the back end of that, he truly believes that community messengers, people who are rooted in communities, can help get through that gap and increase the numbers of vaccination in communities of color.
Okay, I really want to follow up with that point, but before we do that, I just want to touch on, what are you seeing? You see patients, you actually see patients in the ER. Especially with this Delta variant, what we've been reporting here at Bloomberg, what we've been hearing from doctors that we've been talking to, is that especially with this Delta variant, people are younger, they're getting sicker, and they're getting sicker more quickly. So can you talk about a little bit, for people out there, what should they be looking for? What signs should they be looking for in terms of illness, for them to say, wow, maybe this isn't just my seasonal allergies. Maybe this isn't just a summer cold. Maybe I need to look into this. What are the signs and symptoms of COVID-19 right now?
Sure. So I think it's important to acknowledge your statements about the Delta variant causing more severe illness. It spreads rapidly. It has a profound effect on those who are unvaccinated. Like, that's really the key here, is that those who have no protection, no antibodies, they get a more deadly version of this virus, or a more virulent version of this virus, rather. The signs and symptoms are still the same. I'm still asking patients whether or not they're having, cough, shortness of breath, chest pain, if they're having signs that look like an upper respiratory infection. So those things, sore throat, brain fog, like, these things are still commonly reported. Even your gastroenterology related issues like diarrhea or stomach pain are still commonly reported. But I think that the other thing that I'm asking out right now is, like, what's your vaccination status? Like, what is the status of the people you're around? Are you mostly around individuals who are immunized, or are you not? Are you traveling more commonly now? Are you not? Because those things give us an indicator of risk level. So I think that that's a part of my common feel to any patient, and the actual outcomes that I'm seeing. I literally am in a group chat full of about 450 physicians of color, and every day they're talking to me about how this looks like we're taking multiple steps backward, how they wish that we still had some of our COVID tents where we were able to handle extra capacity for patients. And so my concern is that we will essentially head and trend in that direction, where we're having more admissions, more people who are experiencing the pronounced symptoms, shortness of breath, needing to have oxygen support, and hopefully not going towards intubation, where mechanical ventilation becomes a significant factor again. So that's my biggest concern now.
Okay. All righty. So let's move on to the conversation you had with Dr. Fauci. I know the conversation you're having with your peers and with your patients around communities of color, around the Black community, and vaccine hesitancy. There's a wide gamut of people who are vaccine hesitant, but in the Black and brown community, as Dr. Fauci noted, and as you've noted, there are credible reasons. There are historical reasons to be cautious, to be worried, to say vaccines are not for us. They are the Tuskegee experiments. They're the sterilization programs. We can go on and on. There are a number of historical reasons. Do you want to comment on that a little bit, but then perhaps talk about and then what? I mean, it's really important to get to. And so where do we go from here?
No, that's significant. And I do think that we commonly default to Tuskegee because it's the one that, I mean, there's a movie made about it. Most people's parents remember it, or most people's grandparents remember it. And it's easy for us to anchor on this, atrocity in American culture, right? But that's not the only event. There is a legacy of this in America where Black bodies have been experimented on without consent, where there have been, gynecological procedures performed on women of color without any anesthesia because it was believed that they didn't feel pain. These are real events. They occurred, and we have not had the restorative justice that should be afforded to communities of color take place yet. So with that said, the vaccine hesitancy, I mean, there's hesitancy in general around approaching healthcare, especially when you start to think about access issues and all the other social determinants of health that compound our existing distrust of the healthcare system.
So how do you, as a physician and the other physicians that you work with, how do you counsel community members to move past that, or to try to understand why this is different, or why there should be trust, or why there could be trust?
Karen, it's very difficult sometimes. It requires not just familiarity with communities of color or communities that have been traditionally marginalized, but it requires a certain degree of savvy in how you build and construct messaging, right? So on one hand, I could walk up to any person and find a layer of communication that permeates. But when you talk to people who have deep entrenched generational trauma, you have to be mindful. And it starts with listening. It doesn't start with you, preaching or belting out recommendations. It starts with you actually taking inventory and collecting the thoughts and impressions and perspectives of the people that you're trying to reach. The next layer I think that's important is when you communicate, having accurate information, not just what's hearsay, not what's circulating through memes and through social media culture, but actual hard facts backed by numbers, backed by the studies and the people who've done the studies to draw upon. Because I think that we respect, and when I say we, I mean communities of color, we respect fact, we respect truth. And so you have to use that as the currency when you're reaching people from these communities that have been overlooked.
And I think that's a really interesting point, because I think sometimes there's the belief that people who are choosing not to be vaccinated, that they are not, they're incapable of understanding.
You're right.
They're not intelligent.
Right.
And this is not about intelligence. This is about something else.
You're right. I mean, I'm so sorry. I didn't mean to cut you off, but you really said something significant there, is that there's an assumption that people of color or people who come from these communities are on the lower end of the information gradient, and that translates into lower education. Sometimes it's not about education. Sometimes people understand that 1 + 1 = 2. It's not high science. It's not something that is a NASA level of education to actually obtain and understand it. Comprehension starts at how it's communicated, how the message is translated. And that's what physicians need to be better at, is being those medical translators that we signed up to be when we join medical school, being those communicators that actively seek ways to better reach our patients.
And so are you hopeful? Are there enough Is the medical community up to this task? I mean, I know there's you. I can see you. I believe in you. So and I'm not making light of this at all. I mean, I at all by any means. I know that in my family, like many families, we've been touched by this virus. But how do we get the medical community, the frontline workers who are so pressured, and the population out there everyone wants to be in the same place, right? Everyone wants to get on with their lives. How's this going to work to have that time? Because it seems like we don't have a lot of time here, right? Winter's, I mean, I wrote to you and I said, winter's coming, and literally, the winter's literally coming. How do we get everyone kind of moving along? Do doctors have the information that is needed? There are organizations in a lot of communities. I know here in New York City, we're really lucky. There are lots of local organizations.
We're doing okay. I will say this. I think that more now than ever, the physician workforce is invested in seeing us get back to normalcy because, we're still seeing high volumes of patients. We still understand that the healthcare system has the same flaws that it had prior to COVID, and now it is just like exacerbated and compounded. So there is a vested interest in wanting us to return to somewhat normalcy. The other thing I think is important to note is this is one of the first times I've ever seen the effort span across disciplines, span across like different state lines, like different healthcare systems, because in fact, we know that this collaboration is what gets us closer to getting back to normalcy. And then I think the last thing is communities of color have produced some resilient individuals. And there are a few of us who were able to become physicians. And so that DNA is interwoven into our healthcare system and imprinted upon all layers of workers, whether we're talking about our mid-level providers, our nursing staff, our secretary support staff. But that team environment that has the DNA of people who come from struggle are not going to give up. We're fighters. And we've decided to really work together and leverage our identity and leverage our purpose to try to reach communities of color because we know that they are disproportionately affected.
Is there anything that, because I'm going to wrap up here, is there anything that I didn't ask you that you think is important for us to mention? We did talk about, the signs and symptoms. We did talk about vaccine. Is there anything that I didn't ask you that you think is important that we should touch on before we wrap up?
I got one thing that I think is extremely important. So I work as you mentioned earlier, I work as a part of TrapMedicine, Chief Impact Officer. In this model, using barbershop-based health initiatives is not new. This is something we've done to control blood pressure, address heart disease. We've addressed medication and non-adherence, violence, all types of issues, STD, HIV rates. And so it only makes sense that this model can be re-implemented to reach people who are dramatically affected. And so using barbershops and salons as a venue to have these conversations among experts is incredibly disarming, meaning it puts everyone at the same level. The other thing that it does, it allows for on-site intervention. We can vaccinate right there in barbershops. We can vaccinate in mobile health units right outside of salons. As long as we have the resources, as long as we have the support, I truly think that we can close that gap, that 1.4 times less likely to have received the first vaccination that community members of the Black community members have demonstrated. We can really close that gap. So I just encourage people to lean into these non-traditional models of reaching people who often get left out of the conversation.
Well, Dr. Brown, thank you so much for joining us. I think I'm going to have to ask you to come back and do a refresher with us again.
I'd love to.
In the fall season. Really, really important conversation to have. I know I just reached out to you on Monday, and I really appreciate your scrambling to join us today.
No problem.
You please stay well, because we need you to stay well so you can help keep the rest of us well.
As long as I have my N95 and PPE.
All righty, sir. Well, thank you very much. You take care. Right. Well, that'll do it for this week's Black in Focus. Next week, a conversation with Clint Smith. He's the author of How the Word is Passed, A Reckoning with the History of Slavery Across America. Until then, for Black in Focus, I'm Karen Toulon, and this is Bloomberg. Have a good day, everyone.